Hello, I'm Amy Anderson with ACG Practice Partners, and I'm so excited to talk today with my colleague and friend, Davina Isaacs. Davina, thanks for joining me today.
Thanks for having me, Amy.
All right, so I just want to jump right into things. You and I have a lot of conversations about patient retention and how important this is in any kind of med spa setting, whether you're part of a plastic surgery practice or a standalone med spa. The whole, success of the med spa is based on that recurring patient revenue and patients coming back for multiple treatments over time, and how important that the practice has to proactively follow
Mhm.
up to make this happen. So you were recently telling me about an experience you had at Pilates that I thought was such a great story, and it really reminded you of some lessons we can take back to the med spa. So let's start there. Tell us a little bit about what happened at Pilates and how that impacted you.
Yeah. So I have been going to a Pilates studio for a few years, and last summer I had done my checkoff to do the 2.5 mastery level class, and so had been accepted into the class and had gone for a few classes, but I felt like I was just kind of struggling. I was kind of pulling the instructor over because they were having to, do some corrections in my form. And so I just kind of felt a little out of place. And so I just stopped going to the class. And maybe a month or so later, I ran into the instructor out, just out on the street, actually. And so she came up to me and she said, Davina, where have you been? We've really missed you in class on Fridays. And that made me think, I had silently just stopped going to class. And how often do our patients do that? And so when she mentioned, that she had noticed that I wasn't going to class, it really made me feel seen and heard. And it encouraged me to go back and, really work on my practice.
Well, I love that story because it really highlights the power of a simple comment, right? It was, and this wasn't even something she went out of her way for. She didn't call you, she didn't text you. She saw you in passing, so the opportunity was there. She could have smiled and waved, said, "Good to see you," but she actually took a moment to stop and tell you, like, "Hey, we missed you. We'd really like to see you come back." And sometimes it really can be that easy, right? Just that simple outreach that, I see you, I miss you, I remember you, and I really want you to come back. And sometimes that's all the push or the nudge that somebody needs.
Absolutely. And I think, what if I hadn't run into her on the street? I would have just never gone back to the 2.5 class. And so, thinking through, if she had proactively reached out to me after I missed a few classes and said, Hey, where are you? We miss you. We'd really like to have you come back to class, or ask if there were any hurdles or concerns I was having into why I had stopped going. That would have, kept me going to class. It would have shown that they really cared about me and they missed me. And I wasn't just a spot on the reformer, I was a person that, they recognized.
Yeah. Well, so you shared that, you stopped going because you were kind of doubting yourself. You were feeling a little uncomfortable, not sure if it was the right class for you, and maybe admittedly it was challenging. I've been to that class. It's really hard. And I have not been back. So what when we think about that in the med spa context, this is kind of in your circumstance, you kind of quietly drifted away. You didn't make a big deal. You didn't cancel an appointment. You didn't tell them you're not coming. You just kind of quietly stopped going. How do we see that happen in med spas? Like, what are some of the common reasons that patients might quietly drift away?
Yeah, I think one of the biggest mistakes too is that practices often thinks that silence means that they're not interested.
Mm.
And in fact, oftentimes people just get really busy. Life changes, there's vacations, they get off their routine. Sometimes they just forget to book the appointment. Or oftentimes they're unsure of what the next treatment is or the next course of action. And so they're really waiting for guidance often. And so, which is why I know it's another topic, but I always talk about annual treatment plans just to give patients, their journey and their map of what to expect coming up over the next couple of months.
Yeah. Well, I think we can talk about that for a moment because the annual treatment plan I know is it's a hallmark of what you teach to aesthetic providers and the practices. And it's for this very reason, right? If we are scheduling treatments just one at a time without a clear plan of like what are our goals, what are we trying to accomplish, what are the series of treatments that are getting there. If it's I come today and I get my neuromodulators, and then in a few months I feel like getting a facial, and so I make that appointment, and then maybe I'll get a laser treatment. Those are just episodic, and there isn't necessarily even a strong reason for the practice to follow up, but the patient doesn't have that connection. Where when there's a plan, it's like, okay, but now you're due for the next step of your plan, right? We've mapped it out month over month, what that treatment looks like. And so, we're treating this from a couple different angles by having that cohesive plan. We
Yep.
now have reason to schedule a next appointment, follow up if they cancel or if they miss, right? It all ties together so nicely.
It really does. Our number one focus should be on reaching the patient's goals. And so we know if we develop a really good comprehensive treatment plan and we are their accountability coach into helping them come in, remember to come in, remind them if they missed an appointment or if they've, gotten a little lax on their home care, skincare routine. That's our responsibility is to really help them reach their goals. And so we know if we do that on a consistent basis and do professional treatments, then we get better outcomes. And so retaining that patient is really important. And when patients have a journey mapped out for them and they know their course of treatment, they're less likely to wander to a competitor's practice because they are committed with their aesthetic provider.
That's right. That's right. So I know you talk a lot about proactive follow-up. And so not just that passive responding to patients, but proactively reaching out and following up. What does that actually look like? How do we do that?
Yeah, great question. In a really well-run practice, follow-ups are not random. They're intentional and they're built around, and into their workflows. It looks like a 24 to 48 hour post-treatment, follow-up message could be a,
Mhm.
hey, how are you healing message. It's also a reminder when they've missed an appointment or they're due for a maintenance treatment. Could also be a, hey, we haven't seen you in a while. Just that way we have re-engagement. It's not complicated, it's just consistent.
Oh, I like that. Not complicated, consistent. So, if there's a practice that is not doing any kind of planned or structured follow up today, what are some things they can start doing to implement this?
Yeah, if a practice is doing no follow-up today, I would say don't overcomplicate it and start it with just three small things. I would do the post-treatment 24 to 48 hour message, kind of a follow-up. And then if you haven't seen the patient in 30 days, I would do a 30-day follow-up. We know that many treatments in, med spa setting requires or best optimal outcomes do happen with, consistent treatments every, 28 to 30 days. Another one would be just a we miss you message if they haven't been in 3 to 6 months.
Mhm. Okay. And who should be sending these messages? Is this the provider? Is this the office staff? Does it depend? How would you set that up?
Yeah, that's a great question. I think that, you could use some automations, especially for, appointment reminders. I think
Mhm.
that could also be a 24, 48 hour follow-up message that could also go out. And then, I would say that can be done by the front desk.
Mhm.
And also, I believe that the provider should also proactively be going out and messaging. And I have to put this in here, they should be using the practice communication tools and not using their personal cell phones to reach out to the patient. Um,
Great point. Thanks for throwing that in there because that is something we do frequently see and for so many reasons, but primarily patient privacy and documentation and just to protect, that relationship between the patient and the practice. Absolutely. Where you want all of this communication to be through the practice's phone system, CRM, EMR system, any of the practice technology.
yeah, absolutely. Yeah, for sure.
Good. Okay, so it doesn't. necessarily have to be the provider that's doing it. We can balance this between using some automations, using the practice staff. I do think sometimes just the hardest part is deciding to do it and then building in those reminders, deciding who's accountable. If we're doing calls or text 24 hours after treatment, is that the provider, is that the front desk, or is it an automation? Now let's set it up. And then somebody,
Mhm.
even if it's an automation, has to own that process, right? They have to make sure it's happening, notice if it didn't go out. Obviously, if the patient responds, we've got to now respond back to them and
Yeah.
kind of follow that engagement from there. I often find probably the most challenging is those quiet quitters, right? That maybe they didn't schedule their next appointment when they left, and so it has been 45, 60 days or longer. They haven't been back in. Like, who's going to notice that? Like, should that be somebody's job to run reports and look at the schedule and then reach out to those patients?
Yeah, that's exactly what I would recommend, Amy. Having maybe the front desk or designated person running those reports. I do think if you wanted to elevate it, having the provider send out that message because they could tie in things that they had discussed during the previous visit, especially and tie it into their treatment plan that they have established for them. And that makes it feel a little more genuine and authentic.
Yeah. So, some providers or office staff say that all of this kind of follow up, it feels pushy or it feels salesy. How do you respond to that?
Yeah, I hear that all the time. And I agree. I think if your goal is to close a sell, or just to be selling, then it does feel pushy. But I think if the intention is to truly care about the patient and to build the relationship, I think that lands very differently. And patients don't feel bothered, but rather they feel remembered and seen.
Hmm. Well, I think about it, particularly the initial follow up, but I mean, really any of the touch points. You start developing a relationship with your aesthetic provider on day one, and depending on the treatment, you're in that chair for 15, 20 minutes or an hour. And if you're getting a facial, you're there, and you're probably sharing a lot of things, a lot of personal things with your esthetician or your
Yeah.
your treatment provider, and it almost feels weird if they don't follow up, right? Like I thought you cared about me, like I thought we had this connection, and
Yeah.
now I only hear about you when, I have an appointment reminder versus, hey, just checking in, or I miss you, would like to see you back. Like that actually does feel genuine if it's done
Mhm.
in the right way and not just a salesy pushy thing.
Absolutely. A lot of times I feel like patients come in and they think of their provider as their friend, their confidant, their coach. And so when they don't hear from you, it feels a little like, hey, I was just a number on the calendar for that day, just an
Mhm.
appointment.
Yeah. So, um, what kind of measurable impact have you seen? I know you've worked in several practices, and now as a consultant, you work with dozens of practices every day. Um, Practices that have implemented a consistent follow-up system, how has that impacted them?
Yeah. We see increased booking rates. We see higher patient retention. More referrals come in. Patients often leave better online reviews because they're excited to talk about how they felt,
Mhm.
not just the results. And so, if you really make somebody feel that they've been seen and heard and valued, they will often, voice that to the community.
Yeah. Oh, I love that. And that word of mouth, that travels, right? That's better
Yeah.
than any kind of SEO or paid ads that you can do.
Yes, absolutely.
So, thinking about just patient retention in general, knowing that that's the name of the game for non-surgical services, we want patients coming back time and time again. What is the biggest mistake that practices are making when it comes to patient retention?
I think the biggest mistake is that assuming that retention happens naturally. It doesn't. Retention is built, it's intentional. You need to use systems, consistency, and human connection. If you're not actively nurturing the relationship, then you're passively losing it.
Ooh, I like that. If you're not actively nurturing it, then you're
Mhm.
passively losing it. So, That's amazing. I think that just like everything we do in aesthetics, it needs to be intentional. There's a lot of potential things we can put our time and attention to, but if we're not intentional and structured in our approach, then we're kind of just like throwing spaghetti at the wall, right? Hoping something sticks. So, well, thank you. I think this was super helpful. Just very practical. We often say that the biggest changes are very small tweaks to a good process. And so this doesn't take, a whole new software system. It doesn't take, three new people and all these workflows. It's just assigning some accountability and being intentional about building in those follow-up steps.
Absolutely.
So, well, thank you so much, Davina. This was amazing. Love talking to you today. Thanks for being here.
Thanks so much.